We are pleased to introduce Dr. Ashraf Ismail from Egypt, Chairman of the General Authority for Healthcare Accreditation and Regulation. Maybe you already heard the abbreviation for this is gahar. So, Dr. Ashraf, the floor is yours.
Thank you very much. Good morning, everyone, all the participants. Good afternoon, good evening around the globe. It is really my pleasure to be with you today addressing this very, very important issue. And I'm sure everybody who is participating today and who will be watching this series is particularly interested in this very important topic, which is the safety and the application of safety around the globe. As we all know that safety has become priority number one long time ago. And there was a lot of talks, discussions, education, understanding around the globe about why patient safety is important, what are the elements in patient safety, what are the patient safety goals, and different countries took different avenues in identifying those goals. From United States Joint Commission that identified the national safety goals as 14 goals, which represent the most important events. And then the JCI, the international safety goals, different national also accreditation bodies around the globe that identified different numbers in different terms for patient safety goals. Like in gahar, for example, we identified more than 30 patient safety requirements, which are really representing the most important and serious issues that are facing patient safety. So I would say that there are different goals, but we need to realize that these goals are really goals, and what makes them happen are the plans and the real implementation for those goals. They are not just being implemented by adopting them or understanding them or considering them in our mind or in our documents, in our strategic plans. But what really makes them happen is the implementation of the plan that make them happen. And when we come to implementing those goals ranging from all kinds of, we have plenty of those goals in different details and different dimensions. But when we implement and we start to expect the results, we find that this is very challenging. And the results sometimes are disappointing because we don't get what we expect from this implementation. The question always why, and whether those reasons and challenges are the same around the globe in different countries, in different settings, in different hospitals. We have to search and we need to understand what are those challenges that make the implementation of those patient safety goals happen. The reasons and the causes are so many, and they vary from place to place, from country to country, from setting to setting. So the deep understanding and the root cause analysis of this is very important so that we can address the right solution. Given the fact that there is no one solution that fits all. There is no generic solutions for the same problem. And we will give examples of the issues that we are addressing today in hand washing, in patient identification, and other issues that we are addressing, that we will find out that there are many reasons for those problems. They vary from organization to another. So let us start by addressing those challenges, and this will open a lot of discussion for various reasons why we are not meeting and underlying causes of why not achieving what we wanted to achieve in patient safety. The challenges, as I said, are so many, and they vary from different categories, I would say here, and then we will discuss what in each category, and perhaps we can come also to what will be the solution. The first, actually, big challenge in implementing patient safety will be related to environmental factors. And we will see how this environment can control the implementation of those safety goals in general. We have also the culture issue. And this proved in recent years to be one of the main reasons when the culture of safety is not there or there, but we cannot enforce it. We will see how those cultural issues are really affecting. There are many reasons related to the system, the processes, the complexity of those systems, and the underlying causes on those systems are so many. The resources and the resource allocation and how the resources are available, this is one major cause. Technology and equipment prove to be also a very big challenge. We are going to address and talk about how this represents a barrier towards patient safety. And human factor is a major cause, whether it is from the provider side or from the patient side. And finally, an important issue is legislations and the structure of legislations in different countries and how this affect also the system and as related to the legal issues related to errors and the system related to patient safety. So if we start by the environment, we will find actually that the risk in healthcare is so many risks. The healthcare facilities is not a very safe environment by nature due to many factors related to the technology we are using, related to the patients we are treating, related to the complexity of the operations, related to the nature of operations, the surgeries, the anesthesia, the kind of gases, the medications. So there are several risks related to the healthcare facilities. If we do not realize them, we cannot really address them. And related to this environment is the structure of the hospital itself and how the hospital is being designed and built to address those risks and make sure that the design is designed to be error-proof to prevent those errors. The design, in fact, in many hospitals around the globe has been built many years ago, decades ago, when the codes for building hospitals were not taking into consideration any measures for patient safety, which were not really well formulated in the last century. They have been, there is a lot of now evidence-based design, a lot of research that prove the direct relation between design and patient safety. Examples for this, let us think about hand washing and the availability of sinks around the hospital, where they are located, what kind of water splash they are using, the plumbing system that is related to this, whether they are outside the patient room so they can be used before entering the room, or they are inside the patient room, where they are located, inside the patient room. The examples and the challenges are so many in this. Sometimes it's related also to water tanks, where are they put in the design, where the flow of water inside the hospital, how clean is this water being used, and making sure they are not source of infection, etc., etc. The floors, if we are talking about patient falls and the design of the floors, how slippery they are, the kind of finishing they are using, whether we are using carpet, using marble, using any kind of material which really can be a reason for falls, the light itself and the distribution of light, especially at night with patients who are drowsy, who cannot really help themselves. And then when they usually fall, when they go to the toilet at the middle of the night. So a lot of issues related to design, if they are not taking into consideration those patient safety issues, it can lead to serious errors and serious problems and consequences. So definitely, when we think about that, there should be a lot of work to do about the solution about this is to realize how risky is the environment in patient care in different settings, and taking all this into consideration when we design the hospitals and implement evidence-based design. And this becomes a science and something that the whole world really should consider when we think about the highly reliable organizations. This must be taken into consideration in all our current work and future work. The culture. Culture is very, very important. It is the collective thinking of the organization and what are the beliefs that control what we are doing in our organization. So in many organizations we see around the globe, there is lost sense of responsibility towards safety. They don't know who is responsible. And I think sometimes that the security officer or the safety officer is responsible for safety, and they think that leadership is delegating this responsibility sometimes because it is not there in their radar screen. And this is transferred to the whole culture, that they don't feel that everyone is responsible, and this creates a huge lack of responsibility and awareness around the organization related to the different roles. Leadership is not committed. This is number one problem. If leadership is not committed, they don't understand what they need to do about patient safety. Forget about implementing and enforcing any kind of policies or achieving goals or anything, because everybody will follow the radar of those leaders, and definitely it's not going to be a priority. It's not priority for the leadership. The fear culture is a big enemy here, because if we do not report errors and we don't learn from mistakes, we will never know that there is a problem. And the biggest problem in patient safety is not to realize that we have a problem. There is a false sense of security, false sense that we are doing the right thing, false sense that this is what the best we can do. And this is a big barrier. And over and above, there is a fear factor from important people in the hospital or in the facility, fear factor from the surgeon not to report in the operating theater if we don't follow safety measures. So fear factors between the hierarchies in nursing or between nursing and the physicians. This actually a huge enemy of all issues related to safety. Definitely, we need to create this, the sense of responsibility, and everyone is responsible. This notion that we are using, we need to translate into real work and real action, real plans, and everybody get involved in the right way. Leadership is the key, and leadership has a responsibility, and most standards now address the direct leadership role in implementing patient safety, and there is no way that this can happen without the leadership. Creating just culture and creating the culture for quality and safety, everybody is responsible, and also we are not really implementing the blame culture, which is very dangerous, but just culture that really makes people responsible, willing to report errors, and if there is a problem in the system, should be fixed and not always blame the person. However, if some people are reluctant to implement those rules and regulation for intentionally and violating the safety rules, there is no compromise here, and also those people should be really disciplined and should be following the system the right way. So the cultural issue are really, really key to this. When we come to system and the resources, we will find that the systems inside hospitals are very complex by nature. We are dealing with so many factors, variables, patients, diseases, providers, different schools of thought, different. So the system here actually should be designed addressing all those issues. And if the processes within the system are complex and people have difficulty to understand and comprehend them, this always leads to errors. So streamlining the processes is important, explaining it to the people and understanding those, adopting those processes which leads to the policies, to the procedures and the policies that will be implemented. If they don't adopt it and implement it, we will always be in trouble with implementing this. The system itself should, if it's not designed to take into consideration the safety measures, there is no way that it will be implemented. The lack of adoption of the safety policies due to lack of enforcement and sense of irresponsibility, and also lack of consequences. People sometimes ask, what's going to happen to me if I don't do this, or if I don't wash hands, or I don't do patient identification every time? So there is lack of adoption due to maybe lack of enforcement of those policies. Staff are not trained sometimes. We get a lot of staff. We know all around the globe that we have shortage of healthcare professionals. So we should not expect that we always get the people who are competent, who are top-notch, but those people always need training, and they need follow-up and need competency testing. And we need always to work on this, because every day there is also new technologies, new systems that always need to be introduced, and people need to be trained on this. Lack of resources, we're getting surprised when we go and find in some hospitals there is no soap for hand washing, for example, or the gel is not there in the dispensers, or sometimes water is not available all around. Sometimes we don't have enough number of people to do the job, and the nurse has to be occupied all the time carrying things back and forth, and they don't have time to do certain things like washing their hands every time they get to the patient. So lack of resources, whether it's human resources or the materials we are using or the equipment we are using, the sterilization issues, all kinds of resources should be there in order to ensure that we implement what we plan for patient safety. Communication. Represent more than 63% of the problems in errors and patient safety. It happens because of poor communications between the providers, between the teams, in between the shifts. People do not write everything clearly, they don't communicate it clearly. So the handover and the communication between caregivers has been addressed in all patient safety goals. The teamwork and the huddles and in the operating theater, in the awards, and it has become more and more important. Communication hierarchy between all the levels in the facility, leadership and staff. All the communication issues is really could be a big barrier if it is not well formulated. Definitely, we need lean strategy to address those complex processes and to streamline the process, eliminate all the unnecessary steps from those processes. Definitely, we need to embedding the safety culture and take into consideration all the safety measures when we design the processes, engagement of different stakeholders, in the process to adopt those processes, competency assessment all the time, allocation of budget and resources, and well-defined channels of communication across the levels in the hierarchy. Technology and equipment is a big issue, because in many places also sometimes you have obsolete, unsafe technology. And the obsolete, unsafe technology in all aspects, in all the hospitals, in many hospitals, they don't invest in upgrading and improving this technology. This technology can be unsafe by definition, and the equipment are source of maybe radiation, source of infection, source of inaccurate results, all kinds of problems with obsolete technology. And people may keep them because they are comfortable working with them, they know about them, but they are not safe. The opposite happens also with modern technology. Modern technology, sometimes we get very high tech pieces of technology, but we don't place them in the right way. We do not really do the protection for them. And our colleagues in radiation and radiation safety, they know the hazards if we don't do that for imaging and radiation technology, for example. And in all kinds of technology, even simple pieces of technology, if they are not introduced well, we can have a lot of problems because we do not really train people and introduce it well to everyone. Inadequate training for this proper technology and unawareness of the importance of periodic preventive maintenance and calibration. Definitely adoption of new technology and safe technology practices is very, very important for safe technology, planning for technology placement, competent staff and their training, and inclusion actually of the preventive maintenance and the calibration for all kinds of equipment. Human factor is a huge issue when we talk about the provider and their competences and their attitude and the behavior and the role model they play to each other. Like in hand washing, for example, we found that if the doctor do not wash their hands, people follow the pattern of this doctor, believing that he knows the best and we don't have to wash our hands every time getting in and out, seeing the patient, etc. This is a huge problem. So service provider, if they are not motivated, not trained, not educated, can be a big, big issue. And then the service recipient, the patient himself or herself, and if not empowered to ask a question, for example, about patient identification, sometimes they cannot ask who you are, and the people are reluctant to introduce themselves every time they see the patient. This also can create a lot of problems if the patient is not empowered to speak up and to be part of the system for patient safety. Lack of education of service providers and lack of supervision weak disciplinary actions regarding reckless behavior, and there is no consequences, so they don't care, and this is a very big issue. Work overload, if they not enough number of those, and lack of rest, and all these are factors which really affect the sleep deprivation, overwork, the low morale in the workplace. All these are directly related to patient safety issues. There's a lot, of course, of actions to be taken in order to reverse all that and to make sure that the service providers are responsible and the recipients also are those who are vulnerable. Is patient engagement, patient education, and their empowerment is very, very critical. The last part here we are going to address is legislation. And in many countries, there are issues related to medical practice, errors, how to treat with that, and the consequences of poor performance, whether from the legal aspect or also from the financial aspect. And now there are adoption of no pay for poor performance, like if infection happens because of some hospital-acquired infection due to lack of hand washing or whatever, or lack of sterilization or bad practice, surgical site infections. Many systems now, they do not pay for any extra stay or extra treatment or whatever for those. If the patient fall during the stay and they have to stay for another 3-4 weeks to be treated from the fall, this actually is not going to be compensated. However, it can lead to legislation and sue the hospitals and may lead to very big punishment and penalties to the hospital. So the legislation here, if taken into consideration, either people understand the consequences, I think this is an important issue. If this is absent, I think this is going to be a barrier because people would not really appreciate the work and the investment to be done in safe practice. At the end, actually, I would say that unless we do real performance improvement methodologies to address patient issues, we might not get good results. And many of the current improvement methods proved not to be effective. And we can discuss this in more details, but definitely we need to adopt robust performance improvement methods which can bring real effect. The last thing here, this is example of a target solution tools that was done specifically for hand washing by Joint Commission in the Center for Transforming Healthcare, and they found very amazing results. There is no one size that fits all. Problems vary from place to place, from organization to organization, and the solution, unless they are really tailored to address those deep issues, usually there is no good results. So this is again something we can discuss in details because we need to get into the depth of those causes to get results. Thank you very much and looking forward to more discussion during this.